Okay, now we're going to be taking a look at vital signs. I want you to get your nursing assistant unit packet out and try to find your reportable condition page, because it's going to be talking and showing you about your normal and abnormal findings related to vital signs. Listed there at the top of that page is for the adult population. At the bottom of the page is for the pediatric population. It's your reference tool to know whether or not you should be alerting your nurse to an abnormality. First thing I want to talk about are temperatures. You have different methods in which to obtain a temperature. The normal one, of course, is an oral temperature. So you want to make sure that you have the temperature that has the blue probe indicating it is for an oral temperature. You may also use this for an axillary temperature. And an axillary temperature is where you're taking the probe, skin-to-skin contact under the arm, so that means moving the arm out of the way, placing it under, and it will record as an axillary temp. I will be demonstrating an oral temp shortly. The other type of temperature that you may be asked to obtain, and only with the physician order, is a rectal temperature. So you won't be using this particular temperature tool. You'll have to find the one that has the red cap. So if you think red rectal, you'll be able to do a rectal temperature. Now, when you are doing a rectal temperature, you will have to make sure you lubricate the probe before you insert. It should be a gentle glide about an inch into the rectum, and then it will record your temperature. If you meet resistance, stop what you're doing and alert the nurse to the fact that you cannot obtain it and the reason why. Alright, so we will be showing the oral temperature for you. You will be practicing these vitals in class, so if you have questions, please make sure you make notes. When you come to the live class, then we'll answer any questions you may have. We're giving you practice time before we check you off on the scales. The other type of scale that we're going to cover is the pulses, so let's go through a few of them. The first one and the easiest one to obtain is the radial pulse. So if you think of your thumb as moving in a radial direction, you want to run that along, and you're going to find the wrist bone, and you're going to apply pressure to the wrist, and you're going to feel the patient's heartbeat. Always use your fingers, because if you use your thumb, you'll just pick up your own heart rate. So we're going to have you locate your pulse. I'm going to give you just a couple seconds in which to do that. And then once you have it, I'm going to have a start and a stop, and then I'll have you practice taking your pulse. Now we're only going to do this for 30 seconds because we're going to multiply it by 2 to equal what we would get out in a minute. If the pulse is irregular at any point, you will check this pulse for 1 full minute. That way we know we're not missing any beats. All right, here we go. Start. Counting. Okay, stop. Take that number, multiply it by 2, and that is your heart rate. That's the easiest one to get. The next pulse that I want to talk about is the brachial. You do need to know where this one lives, so because this is where you're going to line up your manual blood pressure cuff to know where to place your stethoscope if you want to be able to hear a manual blood pressure. So on the pinky side of your body, you're going to run it up to the elbow. You're going to take your other hand, you're going to put your thumb right in that joint, and you're going to bring your fingers over to the outside. You should be able to pick up a brachial pulse. So many times I've seen people try to get that pulse from the center. You won't find it there. It's always living on the outer edge, the pinky side. I do need to know where that locates because my blood pressure cuff is going to be going there. Okay? And we're going to come back shortly to that one. Another pulse I want you to be aware of is an apical pulse. For that one, you will need a stethoscope. The nurses do carry them. Some units have them available for you. Make sure you wipe it down so it's nice and clean for your use and the use of the patient. So what we need to know are our landmarks, because again, we're placing this against the chest wall. So for my patient here, I want to find mid-clavicular. For those of you, that's your collarbone. We want to find the halfway point in the collarbone, and it goes down to the 5th intercostal space. Now, the intercostal spaces are the dips between the ribs. Now, that will lie below breast tissue. So that means my patients or mine will have to lift up the breast tissue to be able to place the stethoscope. Now, Stacy and I work together, so I am allowing her to place the stethoscope for me to listen. All right? You will be doing this for your patients. So you're in there, you're listening to the heartbeat, and what you're listening for is 2 sound, lub-dub, lub-dub. Lub-dub is 1, lub-dub is 2. You're going to have to take and get a rhythm going before you start counting. And then once you get that rhythm, you'll count for 1 full minute. That way you aren't missing any beats. This one does require some practice time, and again, you'll have this available for you during your live class. Okay. So those are your different pulses. The other thing I want to talk to you about are respirations. Okay? Respirations, you have to be a sneaky person to get these because the patient will pattern their respirations for you if they know you are taking it. So what I'm going to do is just turn on my little machine here. I am going to take the patient's temperature, but I'm also going to be looking at respirations. And what I'm looking for is the rise and fall of the patient's chest. Okay, the thermometer is not working. There we go. And so as I have that at the base of the tongue, I am watching my patients rise and fall of their chest. Again, I want to look for 30 seconds and actually count the rise and fall as 1, rise and fall as 2, and we're going to keep doing this for 30 seconds, multiplying it by 2 when I get my results. If my patient is If my patient has irregular breathing, what I want to do is I want to count it for a full minute. If they're unresponsive, what I can do is lay my hand on their chest and count the rise and falls. I also want to pay attention to the rhythm. If there's pauses when I'm not taking in breaths, I need to know for how long. And that you want to make sure you tell the nurse they had respirations of 15, but I had a 20-second pause or a 30-second pause. However it works out for that patient. Okay, and another thing that I want to go over is if the patient, what we can do to check respirations is just have their arm lay across their chest, and you can tell them that I'm checking your heart rate. Well, really, I'm not. I'm holding onto their arm and I'm counting the rise and fall of their chest so that I can truly get an accurate respiratory rate on them. Now, a lot of times your patients will pattern them, so that's why you have to be a little bit on the sneaky side in order to obtain them. All right, now you practice this in class as well. Next thing I want to talk to you about are blood pressures because you will be doing them. Let's first talk about sizing up a blood pressure cup. So you do have different sizes available for you, so you do have to know how to size that cup up for your patient. There is always some type of indicator line on one side, and you'll see an arrow on the other. So when you're putting this on your patient, this indicator line needs to fall somewhere within the index line. It also has on it a little artery marker. This is what you're going to line up along your brachial artery. You want to have this on firmly but not too tight for your patient and above the actual pulse. Okay. You're going to turn that on to get it warmed up. The other thing I want to talk to you about too while we're doing this is the SpO2. Now this is measuring the amount of oxygen that's being carried by the hemoglobin on the blood. It can be intermittent, which I'm going to do, or it can be continuously. People who have nail polish on or artificial nails sometimes will fool this. You may have to actually remove fingernail polish or try an additional site. Okay? So my vital signs machine is setting right here. We have our temperature window right here. We have our SpO2 showing up at 99%. Well, it's 100 now. We have a heart rate of 82, and then we have our systolic and diastolic pressure over here. Systolic is the force of the blood against the artery walls. The diastolic is the resting phase of that. And in between, where it switches from systolic to diastolic, you often hear it referred to the map or means, and that also records here. Some units will need to have you record that, others will not. So I'm just going to run through a set of vitals to show you how this machine works. There are a cover to go over your temperature probe. Stacy's going to help me. And you want to put it at the base of the tongue. And again, while she's doing that, I can be counting the rise and fall of her chest. And it won't take that long. The machine gives me a 36.6. It's oral. I want to make sure that I shoot my thermometer probe off into the trash so that it does not become a slipping hazard if I accidentally lose it on the floor. I have my start button, which on this model is NBP, non-invasive blood pressure. It will fire up. Now while that's going on, there are some numbers alongside of this machine, and they give you the upper and lower limits of the normal range. So anytime these fall outside those ranges, they will alarm. That's your indication that you must report this to the nurse because it's outside of the norm. Now it may be normal for that patient, but we want to make sure that the nurse is alerted to the fact that it did activate the alarms. Okay? So this won't take very long. It'll take it forth, and then we're going to be able to record the temperature as an oral temperature. We've got a blood pressure of 119/66. It's switched up at 78, and she currently has a heart rate of 76. Now we have everything but that one piece, respirations. That's where you have to remember to do that. All right, so this is where we're going to end here. Again, you're going to have practice in the live class. If you need to review this, you can always review it, but I want you to make sure that you come at least aware of what we're going to do. Stacy will now take us to the next portion, and enjoy your time with us. Thank you.